Go. So before I enter the patient's room, I would check the orders to make sure it is the correct room patient, and we are actually here to do a dressing change and flush a central line. I then would walk into the patient's room. I would introduce myself. Hello, my name is Amber. I'm going to be your student nurse today. I'm here to flush and change the dressing on your central line. I would hand hygiene. I would check the wristband of the patient to make sure that it is the correct name and date of birth. I would ask the patient what their name and date of birth is. I then would close the curtain around us for privacy, and I would set up a sterile field. I would make sure the table is cleaned off. I would then set down the equipment, and I would put on a clean pair of gloves. I'm then going to instruct the patient to make sure they are looking in the opposite direction. I would put a mask on them. I do not want them breathing on their central line where I'll be cleaning and where I'll be dressing. I would also make sure that I have a mask on my face as well. And then I would remove the old dressing. Or before I remove the dressing, I would palpate the area to make sure there's no tenderness, swelling. I would ask the patient if they had any pain in this area. They would say no. Hopefully, we would remove this dressing, even though it's a little hard with these gloves. I would make sure as I'm removing the dressing that we do not pull, oh my goodness, that we do not pull the central line out. We'll pretend like that didn't happen. Beauty mist, trash, and I have a clean trash can right here. I'm going to remove these gloves because they are soiled. And I'm going to put on clean gloves. Now with my clean gloves, I'm going to clean the site. First, I would take my alcohol swab, open this up. I would take out the alcohol swab, throw this away, and I would clean the site itself. Throw this away. I then would use this, pinch it, and I'm cleaning around, under, and then I would also clean the tubing. Make sure to get rid of any residue of blood, pus, whatever may be on it. Throw this away. I then would get rid of my clean gloves. I would hand hygiene, and I need to put on sterile gloves. This would go in the trash. Keep my hands above my sterile field. I then need to dress. We would take our split gauze. Just because of gravity, we want it to be facing upwards, like so. And then we would add a new Tagaderm.
not the one we've been practicing with, so I apologize. Shouldn't we take this off? What do you think? Oh my goodness. Start over. So I have attached the Tegaderm. I'm then going to place a label on it that I then at the end would place my initials, the date, and what gauge we're working with, so that way for future use they know, and they know the correct date, so they know when to do a next dressing change. I then am going to start flushing. So now that we are secure, I'm going to take this guy, I'm going to clean him with a sight scrub. Throw this away. I then would take a clean cap, sight scrub as well. I would get rid of this old clip. No. I would add this flush to the new clip. I would then get rid of the cap. Trash. I would then get rid of this cap. Trash. And then I would attach. I then would, per orders, flush. Usually it's about 10 milliliters. I would make sure this is open. Perfect. Awesome. I then would clamp. I would remove the flush, making sure not to touch the cap. And we're going to use heparin. And we're going to attach again. And per the chart, we would insert the specific amount of milliliters of heparin depending on the patient. I'm going to do about 3 milliliters for now. Dispose. I then would add a green cap, and I could tape this up as well so it doesn't affect the patient. And we are good to go.